Okay, student. Now let us discuss about structure of synovial joint. Synovial joint is an example for diarthrosis. It is the joint is called diarthrosis. Diarthrosis means this allows the free movement. Synovial joint allows the free movement between the two bones. Okay, student. And this is about the diagrammatic part that shows the structure and arrangement of the synovial joint. Okay, student. And synovial joint, it is formed with a double layered synovial capsule. Double layered synovial capsule that forms the synovial joint. Okay, student. Now what about double layer? In this outer layer and inner layer. This is the outer layer, this is the outer layer, and this is the inner layer. What about the outer layer? It is formed with a dense irregular fibrous connective tissue. Okay, outer layer that is formed with a dense irregular fibrous connective tissue, and also collagen fibers is present in it. Okay, student. Next, outer layer that is continuous with the periosteum of the compact bone. Okay, student, this is the outer layer, also continues with the periosteum of the bone. Periosteum is the outer surface of the compact bone. Inner surface is called endosteum. Okay, outer surface is called periosteum. The space between the periosteum and the endosteum, there is a aversion system. Okay, student. Next, another, this is the outer layer prevents the dislocation of the bones. Dislocation of the bones. Next, another, this fibers of layer arranged as bundles. Fibers of layer. This layer consists of fibers. These are the fibers are arranged as bundles called ligaments. Ligament, what about the ligament? Ligament is the dense connective tissue that connects the one bone to the another bone, that is called ligament. What about the tendon? Tendon is the dense connective tissue that connects the bone to the muscle. This is the difference between the tendon and the ligament. Okay, student. Next, inner layer. What about the inner layer? This is the inner layer. Inner layer, it is with the areolar tissue and elastic fibers. Okay, student. This is the inner layer secretes fluid. That is, the fluid is called synovial fluid. This is the synovial fluid allows the free movement of the joint, free movement of the space between the two bones, and it is the synovial fluid is also consists hyaluronic acid, and also phagocytes, also with the phagocytes. Okay, student. Phagocytes also present in the synovial fluid. Okay, it is acting as a lubricant. Lubricant allows the free movement between the two bones. Okay, student, if you observe the diagram, this is the one of the bone, this is the one of the bone, this is the another one of the bone. Okay, these are the end parts of the bone. Okay, student, end part of the bone which is called articular surface. Articular surface of the bone is formed with the hyaline cartilage. This is the hyaline cartilage. This is the end part of the bone which forms the joint to the another. This is formed with the hyaline cartilage. Okay, student, and this is the ligament. Ligament is formed by outer layer. Okay, student. Next, another one. This is the capsule-like arrangement. Capsule-like arrangement. This is the inner cavity. This is the inner cavity. This is called synovial cavity. Synovial cavity totally fills with the synovial fluid. Okay, student. This is about the diagram of the synovial joint. Next, another one, disorders of bones, muscles, joints. Disorders of bones, joints and the muscles. In this first one, what about myasthenia gravis? Myasthenia gravis, it is a best example for autoimmune disorder. Autoimmune disorder. Okay student, autoimmune disorder, it is the myasthenia gravis, affects the neuromuscular junction. Neuromuscular junction, it is the junction between the sarcolemma of the muscle fiber with the motor neuron, dendrites of the motor neuron. Okay student, and when this is neuromuscular junction is affects and action potential or impulse is not received by the muscle fiber. At the same time, it is not goes to the contraction, and mainly this is characterized with acetylcholine receptors. Acetylcholine is the one of the chemical that is act as a neurotransmitter which transmits the impulse into the muscle fiber, sarcolemma of the muscle fiber. Okay, these are the acetylcholine neurotransmitters or receptors blocked by the antibodies, circulatory antibodies produces in the body. Okay, these are blocks the acetylcholine receptors. Okay, and by this stimuli is not received by the muscle fiber, and muscles goes to fatigue and weakness and paralysis. Paralysis is one of the symptom. This is inability of the movement of body parts. These are the symptoms in myasthenia gravis. Next, second one is muscular dystrophy. What about muscular dystrophy? This is one of the genetic disorder, and it is with the progressive degeneration of the muscles. Progressive degeneration of the muscles occurs in the muscular dystrophy, and it is defects in muscle protein, that is dystrophin. Dystrophin is the protein is absence in the muscle. This is the protein helps in growth of the muscle and the functioning of the muscles, contraction, relaxation of the muscles. When defects are available in the muscle protein, and this causes the progressive degeneration of the muscles. Okay student, and muscle growth is sustained and contraction, relaxation is also not possible by the muscles. Next, third one is tetany. What about the tetany? Tetany is characterized with spasm in muscle. Spasm means pain. Next, it is also with the prolonged contraction of the muscle. Muscle goes to the prolonged contraction. Due to that, it is caused by the low amount of the calcium ions present in the muscle fiber or body fluids. Due to the low availability of the calcium ions, muscle not goes to the relaxation. Okay. At the same time, this is shows the prolonged contraction, and it is also caused by vitamin D deficiency and hypoparathyroidism. What about the situation of the hypoparathyroidism? Parathormone is the hormone is not secretes from the parathyroid gland. It is the parathormone. Parathormone helps in increases the level of the calcium in the body fluids. When parathormone is not secreted by the parathyroid gland, that is the condition is called hypoparathyroidism. Okay student, this causes decreases the level of the calcium in the body fluids, and tetany, relaxation of the muscle cannot occur. Okay. Next, fourth one is arthritis. What about the arthritis? Inflammation of the joints is called arthritis. Next, fifth one, osteoporosis. What about the osteoporosis? This is the age-related disorder. Okay, student. And it is caused by calcium reabsorption into the body fluids. The presence of the calcium and the phosphate levels in the compact bone that is reabsorbs into the body fluids or the blood. Okay, this is leads to bony fractures, bone deformities, demineralization of the bones. Okay, student. And another one of the cause is decreases the level of the estrogen in the females. Okay, student, especially this is the disease mostly common in post-menopausal women. Okay, student, and at the same time, pain in bones is also symptom for osteoporosis. Fractures or increases, bone fractures or increases. Next, another one, students, gout. What about the gout? It is the inflammation of the joints. Gout is the inflammation of the joint. Inflammation of the joint is by the accumulation of the uric acid in the synovial joints. Okay, student. And what about the accumulation of the uric acid? Why it is accumulated? By the purine metabolism. This is produces the uric acid crystals. This is the uric acid crystal is accumulated in the synovial joints. Okay, student, that causes the one of the inflammation of the joint is called gout. These are the different types of the disorders about the bones, joints and the muscles.